Hello and welcome. Our topic for today is sepsis and intestinal diseases. First of all, we will discuss sepsis, and we start from some prevalence of sepsis disease, and the forecast for 2020 year is increase the number of cases of sepsis in population. The number of deaths from sepsis in Russia is really huge, is something about 1,500 each year, and the mortality in sepsis cases is really high. It's something about 50%. So, what is a sepsis? Sepsis is a generalized acyclic virulent polyetiological infectional disease which characterized by extremely alterated reactivity of the body. And sepsis has some special features. It is polyetiological disease. That means that sepsis has a lot of etiological reasons. It may be associated with Streptococcus, Staphylococcus, and all other microorganisms except viruses. Epidemiological characteristic of sepsis, it's not contagious, and we couldn't see spreading of sepsis from one patient to another one. It's really interesting characteristic of it. Sepsis can't be reproduced in experiment, and it will lead to some problems with its investigation and researching of sepsis process. Sepsis is a cyclic disease, and morphological manifestations are stem-celled. So we may see typical anatomical manifestation for sepsis, not typical but same anatomical manifestation of sepsis with any different etiology. And immunity from sepsis is not formed. Classification. Classification of sepsis really interesting and difficult, and we can see different ways of its classification. The first way of classification according to entrance gate or route of infection. It may be therapeutic sepsis, and this sepsis associated with some therapeutic diseases like pneumonia, for example, and some therapeutic manipulations. For example, it may be injections and so on. The next type is surgical sepsis. Surgical sepsis associated with some surgical diseases like appendicitis, cholecystitis, and also it may be associated with some surgical infections, surgical diseases. And I have already told about them. It may be appendicitis, and it may be complications of surgical manipulations and so on. Gynecological type of sepsis associated with some infections of reproductive ways of female system. Tonsillogenic sepsis associated with infections which localized in the throat. It may be tonsils, it may be anginas, and so on. Otogenic sepsis associated with diseases of ears, and we may see some otitis, for example, which may have sepsis-like complications. Odontogenic sepsis associated with diseases of teeth, and we may see some problems with teeth. For example, it may be associated with stomatitis. It may be associated with gangrene of pulp of teeth. Also, it may be associated with caries. Umbilical sepsis, typical for newborn, and it may be associated with problems of newborn, and we may see formation of this type of infection. And cryptogenic sepsis, one of the special type of sepsis. Cryptogen in medicine, we called some diseases with unknown etiology, with unknown localization, or some problems with diagnosis. So cryptogenic sepsis is a disease when we can see some manifestation of sepsis which is associated with increase of leukocyte numbers. We can see hemolytic jaundice. We can see increase of a temperature. We can see increase of breathing actions, but we couldn't see root of infection, and we told that it is cryptogenic sepsis. Pathogenesis of sepsis really interesting, and we should understand that sepsis may be associated with different type of infection. It may be streptococcal or fungal, and so we can see different way of spreading of infection. It may be airborne, alimentary, pancreatinous, umbilical, cauterization, pulmonary sepsis, and it will depend only on type of sepsis, type of primary disease, and so on. But the typical characteristic for all types of sepsis will be generalization of infection. It will be associated with systemic endothelial damage of vessels. It will be
Correct.
associated with damage to non-specific link of resistance and insufficiency of T-cell immunity. Clinical and morphological forms of sepsis you may see on this slide. There are three main forms of sepsis, which are septicemia, septicopemia, and septic endocarditis. These three forms are typical and they are more common for sepsis. But actually we have fourth type of sepsis, and it is chroniocepsis. We will talk about it a bit later. You should remember about it, but you should remember as well that it is very rare. Septicemia. It's a form of sepsis which is characterized by pronounced intoxication of the body, increased reactivity, the absence of purulent foci, and rapid, sometimes lightning fast course. Septicemia characterized by local changes are not pronounced, and we really couldn't find any local changes. Also, we can see hyperplasia of lymphoid and hematopoietic tissue, interstitial inflammation of parenchymal organs. Also, we can see vasculitis, hemolytic jaundice, and hemorrhagic syndrome. Interstitial inflammation of parenchymal organs will be associated with productive inflammatory changes in the tissues. Vasculitis associated with inflammatory of small blood vessels. Hemolytic jaundice will be associated with hemolysis of erythrocytes. It is a rupture of red blood cells, and we can see increases of bilirubin level in blood plasma. And this hemorrhage, hemolysis associated with rupture of red blood cells and presence of the microorganism in the blood. On this slide we may see typical histological picture of interstitial inflammation. So we can see healthy tissues, and between them we may see some inflammatory cells here. So this proliferative inflammatory will lead to activation of dystrophy in these cells, and sometimes it will lead to a formation of connective tissue in this area or chronization of this process, and we may see some necrotic area and all other manifestation of productive inflammation here. On this slide we may see second typical anatomical manifestation of sepsis, and it is hyperplasia of lymphoid tissue. On this slide you may see lymph node, and you may see increase of its size. We can see area of hemorrhage here, and we can see a lot of leukocytes in the lymphatic node. It is typical anatomical manifestation of sepsis. Septicopemia. This is a form of sepsis in which the leading purulent process are in the gate of infection. and bacterial embolism with the formation of metastatic abscesses in the other organs. So, septicopemia characterized by presence the changes in the gate of infection, and the second typical formation is formation of metastatic abscesses, and these abscesses we will see in all other internal organs. Septicopemia characterized by formation of septic focus, and it will be a focus of purulent inflammation, purulent lymphangitis, purulent lymphadenitis, and purulent thrombophlebitis. Abscesses in the internal organs, and it's important to understand that these anatomical formation abscesses may formed in all internal organs. They may localized in the lungs, in the kidney, in brain, and all other organs. Septic spleen formation. Spleen in sepsis will be increased in size, will have a lot of red blood cells in it, and also we can see hyperplasia of lymphoid tissue. Also, we can see less pronounced hyperplasia of lymphatic and hemopoietic tissue. So we couldn't see, for example, lymphadenitis or hyperplasia of lymphoid tissue in lymph nodes or lymph vessels, and also we couldn't see some activation in the bone marrow. On this slide, we may see histological picture of abscess, and we may see in the center area of necrotic tissue, and it will associated with some hemorrhages and peripheral inflammatory area in this size. Also, we can see inflammatory cells in this part of the slide, and we can see still healthy tissue in the periphery of it. In the end of its development, we can see formation of wall of abscess, and sometimes we can see dystrophic and necrotic processes in these healthy tissues. Macroscopically, metastatic abscesses looks like white dots in internal organs. For example, in this kidney, we may see small abscesses in all surface of kidney. On next slide, we may see abscess in the brain, and it will be cavity with sap in brain. Histologically, we can see kidney, because we can see glomeruli. It's typical for kidney, and also we can see tubes, and we can see some necrotic and dystrophic change in these kidneys, so we couldn't see any nucleus here and here. Also, we can see some drops of lipids, for example, here, and also we can see area of inflammation here. So on this place, before abscess formed, we should find anatomical formation like that, tubes. But in this case, we couldn't see any tubes, but we can see area with suppurative inflammation, with purulent inflammation here. On next slide, we may see histologically abscess in the brain. So we can see healthy brain tissue on the periphery of it. Also, we can see some inflammatory infiltrate here, and area with accumulation of dead neutrophils in the center of it. So it's typical parts of abscess. On this slide, we may see abscess in the lung, and also we can see center with necrotic tissues and accumulation of dead neutrophils, and periphery with neutrophils also. And in the periphery, we may see formation of wall abscesses with very thin border. You may see it here, like that. The next slide is again with lungs, and we can see accumulation of lung abscess here. All anatomical manifestations are same, so a lot of neutrophils and borders of abscess. Septic endocarditis is a special form of sepsis in which the sepsis focus is located on the heart valves. Localization of it is really interesting because it localized previously on the aortic valve and less often in the mitral valve. So, in result of it, we may see hypertrophy of left part of the heart, and left part of the heart is more typical for the development of septic endocarditis because it is a part of a huge cycle of blood flow. Etiology may be different and it may be associated with Staphylococcus, Streptococcus, Escherichia coli, and so on, and so on, and so on. In pathological anatomy, it's really important to note that according to morphology, we can see formation of polypose ulcerative endocarditis. What does it mean? It means that in the valve, we can see overgrowing of connective tissue and the formation of ulcers in the surface of this valve. Also, it will lead to stenosis in these valves. And I have already told you that this pathological process more typical will be localized on the mitral valve and aortic valve. That's why we may see myocardial hypertrophy and formation of stenosis in the valve. And as a result of stenosis, we may see myocardial hypertrophy. And previously and more dominant, it is hypertrophy of left part of the heart, left atrium and left ventricle. Also, we can see endo and paravasculitis. It's inflammatory injury in the vessels. Also, we can see septic spleen. I should repeat again that septic spleen characterized by increase of size of the spleen, and we can see a lot of red blood cells here and formation of neutrophils, accumulation of neutrophils in the spleen. And one of the difficult and one of the most dangerous complications will be formation of glomerulonephritis, immunocomplex diffuse glomerulonephritis, which will be associated with progress of kidney insufficiency. The next typical anatomical manifestation of septic endocarditis will be associated with hemorrhagic syndrome. Hemorrhagic syndrome associated with formation of special dots like Lukin-Leibman spots on conjunctiva, root spots on retina, Janeway spots in adipose tissue. Also note its formation which consists of proliferative capillaritis, hemolytic jaundice and anemia, and thromboembolic syndrome. So it's really important to understand that Lukin-Leibman root spot and Janeway spot, it is an area with hemorrhage. And also notes is proliferative capillaritis. It's productive inflammation in the wall of capillaries. Hemolytic jaundice and anemia will be associated with hemolysis of erythrocytes, and hemolysis of erythrocytes will be associated with presence abnormal substances in the blood flow, microorganisms. And thromboembolic syndrome will be a result of endothelial injury, injury of vessels, and changes in blood coagulative system. So, on this slide, we may see alterose change in the valve of the heart. So we can see overgrowing of connective tissue and formation of ulcers in its surface. It is aortic valve, and in this condition, we may see hypertrophy of left ventricle. And hypertrophy will be associated with increase of wall of muscle tissue of left ventricle more than 1.5 centimeter. And also, it will lead to blockage of blood flow here. Sometimes it may lead to formation of thrombus and accumulation of thrombus in in surface of heart valve. One more photo with same pathological process, and it's really interesting to note that in the valve on histological level we may see some manifestation of purulent inflammation like here. So we can see accumulation of sap here. Also we can see some necrotic areas here and some dystrophic areas. Craniosepsis. It's a special form which is really rare nowadays, but we should remember about it because sometimes some poor patient, some patient with uh, really difficult life condition may have this one. It characterized by long-term course of sepsis, the presence of non-healing septic focus in the organism. For example, it may be a result of chronic TB infection. It may be a result of chronic lung abscesses, chronic liver abscesses, and uh, some other abscesses with other localization. It characterized by sharply reduced reactivity of the body. So the patient is really weak and we couldn't see a strong immune system response in this case. Pathomorphologically, we can see depletion, brown atrophy of the myocardium, liver and muscles. And we should pay more attention to brown atrophy of internal organ. I hope you remember from our class about mixed degeneration, which brown atrophy is the result of accumulation of lipofuscin in the cells of organism. And lipofuscin is a pigment, special pigment from lipids, which formed in result of chronic diseases like cancer, craniosepsis, for example, and some other, for example, to TB infection, we can see also brown atrophy of internal organs. And in outcome of it, we may see secondary amyloidosis, and it will be atypical changes of spleen because in all previous septical form, we talk about septical spleen, which is increase and contain a lot of blood and white blood cells. In case of craniosepsis, we can see small flabby spleen. So it will be abnormal for sepsis. So it's all about anatomical characteristics of sepsis. The last part of theory about sepsis will be about clinical classification of sepsis, and it will be more useful for you when you will be a doctor in the with clinical practice. And according to clinical classification, we can see 4 forms of sepsis. We are septic, systemic inflammatory response syndrome, sepsis, SIRF sepsis, and septic shock. First of all, we should remember about systemic inflammatory response syndrome. And this syndrome characterized by some features we are body temperature above 38 points or below 36 points, heart rate over 90 points, 90 beats per minute, breath action more than 20 per minute, or partial pressure of carbon dioxide less than 32 millimeters. And we can see also changes from white blood cells. We can see increase of their numbers or decrease of their numbers, and one of the typical and the most dangerous manifestation will be appearance of immature forms of the white blood cells. And all of these features from white blood cells will lead to insufficiency of immune response in this case. This syndrome occurs with sepsis but can develop in other conditions on the body. So systemic inflammatory response syndrome is just it is not diagnosis of sepsis, but it is a complex of syndromes. It's complex of symptoms which should note you to this patient, and you should pay more attention for this patient because his life is really in danger. Sepsis, the presence of focus of infection, so we can see chronic abscess, we can see some inflammatory or purulent inflammatory focus, and two or more sinks of this one. So if you want to put sepsis-like diagnosis, you should find the primary focus and find two or more features from this table. Self-sepsis, it is special clinical form of sepsis which combined with organ dysfunction, hypertension, and impaired tissue perfusion. The manifestation of violation of tissue perfusion, in particular, is an increase in the concentration of lactate, oligoria, acute violation of consequences. So it's really important to understand that in case of sepsis, we can see insufficiency of kidney, liver function activity, or some problems with heart vessels or cardiovascular system problems. Septic shock, sepsis with sign of tissue and organ hyperperfusion and arterial hypertension, which is not eliminated by infusion therapy and required the appointment of catecholamines. So it's really difficult and life dangerous conditions which are necessary to treat and pay more attention to these patients. Way life really in dangerous, and we should save them. Septic as the main disease may be in case of minor injuries, in case of cryptogenic sepsis, in childbirth, the postpartum period, umbilical sepsis, sepsical endocarditis, endocarditis with valve replacement. So you should put and look at the sepsis like a single disease only in these cases. The main disease, sepsis, may be only in these conditions. It's really important to understand it. So it is all about sepsis. Now we should talk about intestinal diseases, excuse me. All intestinal diseases characterized by one way of transmission, enteral way of transmission, and more often it associated with food or water. In all infections except typhoid fever and salmonellosis, we may see exudative inflammation. In all intestinal infections, we can see formation of produce of enterotoxins. In all intestinal infections, we can see local and general manifestations, and we will discuss it a bit later. So, I want to discuss with you today typhoid fever, salmonellosis, dysentery, cholera, and amoebiasis. Typhoid fever is acute infectional disease which is characterized by bacteremia, skin rash, and damage of lymphoid apparatus of small intestine. It is anthraponosis, so the source of infection is ill human. Etiology: Salmonella typhi abdominalis. Pathogenesis of typhoid fever you may see on this slide, but for in a single word, it is difficult immune response and dramatically change of anatomy in intestine, in small intestine previously. We can see that this disease may be divided into three periods. The first period is period of primary contact with Salmonella, and in this period we can see accumulation of Salmonella in the lymphoid apparatus of small intestine. The second period is generalization of infection and accumulation of Salmonella in liver, spleen, and some other internal organs. The third stage of this disease is formation of ulcers and healing of them. So it's all pathogenesis of typhoid fever. But we should talk a bit more about local manifestation and general manifestation. Local manifestation associated with changes in small intestine, and we can see formation of medulla-like swelling of follicles in the first week of this disease, stage of necrosis in follicles in the second week of disease, stage of ulcer formation, and in third week these ulcers will looks like green ulcer because we can see a lot of necrotic tissue and accumulation of a bile here. That's why it looks like green. In the fourth week, we can see clearing of these ulcers, and in the fourth week, we can see bottom of ulcer. And the fifth week, we can see healing of ulcer. General changes in typhoid fever will be associated with rose spots on abdominal skin, in skin of anterior wall of abdomen, and it appear on 7th or 11th day or in case of bacteremia. Also, we can see formation of productive inflammation in group and individual solitary follicles of small intestine, liver, and spleen. Also, we can see dystrophic changes in the liver, kidney, and myocardium, and hyperplasia of spleen. Sometimes we can see wax necrosis of muscles of abdomen wall. It's really typical for typhoid fever. And sometimes we may see inflammation on the cartilages of throat and some cartilages in joints. Complications of typhoid fever associated with cardiovascular failure, specific pneumonia, which happens in first and second week, and it is associated with bacteremia. So in case of generalization of infection, hematogenous generalization of infections, more often we can see interstitial complications which are associated with formation of ulcer, and we can see typical complications for ulcer. We are bleedings, perforations, peritonitis, and so on. And on the fifth week, we may see immunity depression and addition of some secondary infections like pneumonia, secondary sepsis, osteomyelitis, formation of abscesses, and so on. Salmonellosis. So, salmonellosis, it's a group of acute infectional disease with primary lesson of small intestines. Looks like toxic infections. And all of them are anthropozoonoses. And anthropozoonoses mean that this disease the source of this disease may be animals, and not only animals, but food from animals like meat, milk, and eggs. Etiology of salmonellosis are Salmonella enteritidis, Typhimurium, Cholera suis. General characteristics of salmonellosis are associated with increase of fever, increase of temperature or formation of fever, vasodilatation, hypertension, shock, and development of DIC syndrome. According to morphological manifestation, we can see three main forms of this disease. The first one is interstitial or choleral form of toxic form of infection, and it is characterized by acute gastroenteritis. with catarrhal inflammation in the stomach, small and large intestines, lead to degradation of organism, and it is one of the lightest form of salmonellosis. Septic form. Septic form is characterized by mild changes in the intestine associated with hyperemia, edema, lymphoid tissue hyperplasia, and hematogenous generalization of infect. And we can see the typical anatomical manifestation will be associated with formation of abscesses in all internal organs. It may be brain, lung, liver, and so on. And the third form is typhoid fever form, or typhoid fever-like form. It's similar with typhoid fever, but it will never have complications of disease, like ulcer formation, like bleeding, like perforations, and so on. But we can see dystrophic change of myocardium, liver, kidney, and so on. Complications of salmonellosis associated mostly with toxico-infectious shock, and this shock associated with some special toxins which salmonella produced in organism. Cardiovascular failure, and it is associated with insufficiency of heart muscle. Abscesses in internal organs, it is associated with generalization of infection. Sepsis formation, again with generalization. Exicosis. Exicosis is a pathological condition which is associated with decrease of water and salts in the body. And renal failure. Dysentery or shigellosis is acute infectional disease with primary lesion of distal or large intestine. It is again anthrapanosis. The source of infection is patient with disease. Etiology is Shigella, dysentery, flexneri, boydii, or zone. And again, we should discuss local and general manifestation. In local manifestation, we should remember that these diseases injured only large intestine, and mostly it will be associated with formation of colitis. And we can see the first stage, catarrhal colitis, and we can see exudative catarrhal inflammation here. Fibrinose or diphtheritic colitis is the second stage of it. We can see changes catarrhal exudate to diphtheritic one, and after it we can see ulcerous colitis. After diphtheritic form we can see formation of ulcers in the colon, and after it we may see two ways. It may be death of patient, which is associated with complications, or it may be healing. General manifestation of dysentery associated with fatty dystrophy of heart and liver, necrotic nephrosis, hyperplasia of spleen, and formation of pneumonia. Complication may be interstitial and general. Interstitial complications will be associated with formation of ulcers, and in this case we will see bleeding, perforation, and phlegmon formation. And in case of healing, we can see stenosis of colon, which is associated with overgrowing of connective tissue in the colon and blockage of lumen of colon. It's really difficult complication. General complication associated with development of pneumonia, pyelonephritis, abscess of liver, amyloidosis, and cachexia. The next disease which we should discuss today is cholera. Cholera is really dangerous disease which characterized by which etiological factor is Vibrio cholera. You may see it in one B slide. And cholera is not a rare disease. In nowadays we may see a lot of pandemic situation. or epidemic situation in some countries, and the typical way of spreading of this infection is waterway, and pathogenesis of cholera based on produce of special enterotoxin toxin of cholera, which lead to increased vascular permeability and leads to a losing of water by patient with cholera. And we may see formation of diarrhea in the form of rice water, uh, which contain mucus but few leukocytes and produce. And it's really important to understand that cholera toxin increase vascular permeability of intestinal capillaries, and it leads to loss of natrium, kalium, chlor in and volume of circulation blood is reduced, and we can see formation of metabolic acidosis. So all of these manifestations are really dangerous for life of patient. Anatomically or clinically, cholera has three stages. We are stage of choleric enteritis, choleric gastroenteritis, and algid period. In first two periods, we may see formation of cirrhosis or serous hemorrhagic inflammation in the small intestine previously. And in algid period, we can see decrease of temperature, leukocytosis, and lethal outcome or is coming with dehydration. Complications of cholera may be specific and non-specific. Specific complication is formation of choleric typhoid. It's accumulation of typhoid colitis, proliferative intracapillary glomerulonephritis, and rash skin, and choleric uremia, formation of acute renal failure in result of cholera injury. Non-specific or secondary infections is like pneumonia, abscesses, phlegmona, or sepsis. And the last disease will be amoebiasis. Amoebiasis is a chronic parasitic disease with development of ulcerous colitis with localization in proximal parts of large intestine. So it's again colitis, and we can see development of colitis. Amoebiasis is a parasitic disease. That's why it's really important to know their life cycle, and we may see different forms of Entamoeba histolytica in our organism. We are cysts, and also we are adult parasites. And it's really important to understand that the source of this cyst is water, and in case of amoebiasis, we will drink water with cysts, and we will have some diseases here. Pathogenesis of amoebiasis associated with injury of mucous layer of colon and formation of ulcers here. And formation of ulcers will be associated with some necrotical process, with formation of bleeding, with formation of abscesses and phlegmon in colon. Sometimes it may lead to peritonitis. On this slide, you may see scheme of injury in case of amoebiasis, local manifestation and general manifestation. Local changes associated with necrosis of mucous membrane, formation of deep ulcers with irregular age, penetration into the muscular layer, and formation of complications. The general manifestation associated with dystrophic processes in parenchymatous organs, and it may be all different organs. It may be brain, liver, lungs, and I will show you a scheme with different generalization form of amoebiasis. Complications of amoebiasis may be interstitial and they are associated with formation of ulcers, and as usual we can see bleeding, scarring formation, phlegmone and gangrene formation, and it may be general formation of abscesses in internal organs. So we may see complications of uh, amoebiasis and its localization in all these systems and organs. You may see it on the scheme. So it's all for today for theoretical information. Thank you for your attention and goodbye. Goodbye bye.